How concerning is the forecast you just heard Ed talk about? Can you put into context what we experienced this time last year?
You know, one of the only things I know for sure about the epidemiology of COVID-19 is that no one can predict what it's going to do next. Yeah. I've really stopped looking at those forecasts completely. But what I can say is cases are rising. Hospitalizations are too, but less so. And, you know, we saw that Delta-related rise in the summer, and yet the 7-day average of deaths really didn't rise nearly as much. So with our high levels of vaccination this winter, I think we can weather this next storm similarly here in Massachusetts.
Good, that's good to hear.
Dr. Drone, over the past week, Massachusetts reported nearly 7,000 more cases among fully vaccinated residents and 43 additional deaths among the fully vaccinated. Do we have any sense if these numbers are a sign of the waning effectiveness of the vaccines?
I think it's a lot of things. You know, Delta is so contagious, and cold weather might make it more so. The virus is settling into this seasonal pattern, and we can see that plenty of other northern states and northern countries are also experiencing rising cases. But yes, I think waning immunity is also playing a role. And while I'm not sure that boosters will change the shape of the curve, I do recommend that people avail themselves of boosters now before cases rise even more. And of course, if you're not vaccinated, get vaccinated.
So you just said that about boosters, but so you're not sure how it will impact it, but you're still recommending people get them. Can you say why?
Well, I think that on an individual level, it will provide protection. I'm just not sure how it will change the curve of cases in Massachusetts.
So we've been saying it for days. People are traveling. They're going to gather right now, many for the first time in a long time. As someone who watches all of this information very carefully, what are you going to be looking at in the days after Thanksgiving to determine the impact of all of this?
You know, the data are becoming harder and harder to interpret. On the one hand, a lot of people are lining up for testing. I see them standing outside at our testing center here at Tufts Medical Center. So that's going to capture a lot of positives before and after the holidays. On the other hand, people are increasingly using those at-home tests, which is good, but they don't end up in the state data. And I think it's becoming more and more important to look at hospitalization data, but that doesn't really give us the full picture either. Actually, at my hospital, since April, we've admitted 218 patients with COVID. 65 of them were fully vaccinated, but only 37 of those were actually in the hospital due to COVID-19. And the others just were there for other reasons. So we need to do better with our data gathering so we can really tell who's sick from COVID, and so policymakers can make the right decisions.
Great explanation, Dr. Drone. Thank you.